Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. We continue this month's theme of the gastrointestinal tract. Today's case is an 8-month-old female neutered Rottweiler who has a 3-day history of vomiting, diarrhea, and worsening lethargy. She is inappetent and has progressed to anorexia. She is quiet, uncomfortable on abdominal palpation, and is salivating profusely and has vomited several times since admission. Her rectal exam reveals gritty diarrhea. Evaluation of lab work reveals a leukopenia with neutropenia and inflammatory leukogram, mild hyperphosphatemia, and hypokalemia. Let's take a look at her abdominal radiography. These two lateral views were captured approximately a minute apart if we look at the timestamps. In these views, we observe that the changes evident in the small intestine are global. In other words, all of the small intestine are impacted. And what we see in the right caudal abdomen is that there are a couple segments that exceed what we would anticipate as an appropriate level of dilation. And on the left lateral view, other segments exhibit inappropriate dilation, but they vary between the two views in terms of which segments indicate this. There are some segments that appear more normal in terms of their intraluminal diameter, where they're filled with a small volume of gas, and some segments that have a more heterogeneous appearance within the lumen. Some segments have more gas that otherwise appear within a more reasonable diameter in the other image as well. On the right lateral view, we see a segment of intestine that this has kind of a ripple appearance where we would term that corrugation. And what that suggests is that there is peristalsis. This peristalsis can be normal or it can indicate hypermotility, and this comes back to clinically what we think is going on with the patient. There is not a tremendous volume of feces that's present, which would support the clinical description of diarrhea, but we do observe that there's some fine granular mineral material, which would also be consistent with the described gritty quality of the material found when a rectal exam was performed. And so in this case, we have a global change of the small intestine, which would fit with a global enteropathy or gastroenteritis. And that gastroenteritis can be due to a number of different things. It could be also associated with a early distal mechanical obstruction. However, given the presence of a corrugation and the vast changes between the appearance of the small intestine between the two views, I suspect that this patient would have hypermotility between of the small intestine, which would be more consistent with a gastroenteritis. And so you could consider serial evaluation if you were concerned that she did have an early mechanical obstruction. You could also pursue a sonogram to assess for what are changes that are going on. However, given how young this patient would be, we also have to consider the possibility for infectious etiologies that can include viral infections like parvovirus or parasitic infections as well. With respect to parvovirus, then it becomes a hospital management scenario of how do you manage this patient safely if you have to do additional imaging where you're not moving this patient through your hospital and potentially resulting in contamination. So you do have to be mindful with respect to that. This individual was later confirmed to have, in fact, parvovirus afterwards, and so medical management was sufficient to help her fully recover. Be sure to view the full report associated with this case. Thank you for listening, and remember, it's your case, so please post your questions on social media.